My name is Aaron Graham. As we were talking, I'm a former DEA agent. I actually spent 3 years in Guadalajara after Agent coming in. I was kidnapped and murdered. So some of you are familiar with the show Narcos, and season 3 represents the time I was there with my wife. I grew up on the border. So I grew up in the Latino culture, living in Tijuana, Rosarito, Ensenada, and then ultimately Guadalajara, and then Tucson, which we call Nogales Norte. And we just met each other, and yet we're on the same page in 2 minutes. Everything that we have seen in our respective areas is true. I would tell you that in the medicine area, so I work for Boehringer Ingelheim Pharmaceuticals. We're a large privately held company in Germany. But what I see in our country today, and as the sheriff was saying, we really have a humanitarian crisis when it comes to access to equitable health care and affordable medicine. And so when you have dysfunctional health care, you have dysfunctional immigration, and then guess what? The cartels from Mexico and MS-13 see that immediately and exploit it. And then once they see that, what I would call an underserved community, they may have come with counterfeit medicine, but now they're coming with counterfeit, illicit vapes and cigarettes. And now they're bringing their trafficked children into that community, because now it's this shadow economy where they think nobody's looking, nobody's watching. And so it's really a holistic picture of all of these factors that are driving. Trafficking is a very comprehensive, large term. The counterfeit medicine market, how many people in this room, in your community or near your community, have a bodega or a yerberia or a flea market where they're selling counterfeit medicines? And how many of you think the medicines being sold there are legitimate and authentic? But I want you to imagine now, you don't speak the language, you came from another country, your immigration status is not in order, you don't have health care insurance. How does a country, I want to ask the question, how does a country where Hispanic-owned businesses generate $800 billion to the U.S. economy, where Latino entrepreneurs are starting businesses at 3 times the rate of any other demographic, and yet Latinos have the lowest insurance coverage per capita of any demographic in America? Seems like a disconnect.